G'day champions, it's Stuart Stone here from Health and Fitness Over 40, and this is the second video in our series of the easy way to stop smoking. And today we're going to look at how long it takes your body to heal and repair when you stop smoking.
Now, this research was done with people who stopped smoking cold turkey. It doesn't take into account when you use nicotine replacement therapies, whether it's gums, patches, lozenges, vapes, or anything else. So here's a breakdown of how your body responds, and its ability to mend and repair itself is absolutely remarkable. So within 20 minutes, your blood pressure, pulse rate, and temperature of your hands and feet have returned to normal, and after 8 hours, the remaining nicotine in your bloodstream has fallen by 93.75%. 12 hours, your blood oxygen level has increased to normal, and 24 hours, your anxieties have peaked in intensity. Now, 48 hours after you stop smoking, your sense of smell and taste are beginning to return, and your anger and irritability will have peaked. In other words, the short-term psychological effects from smoking are very short-term. They've peaked after 48 hours of stopping smoking. From a physiological and physical point of view, it's a relatively easy habit to break. But let's go on. So after 5 to 8 days, the average ex-smoker will have 3 craving episodes per day. And when they say cue-induced, it's various triggers, whether it's after a meal, after a beer, or after sex, or whatever else that you'd normally have a cigarette. You'll get those sort of cravings. About 3 of those a day. They won't last longer than 3 minutes at a time. And after 10 days, this will drop down to 2 episodes a day. Now, 10 days to 2 weeks after you stop smoking, your addiction is no longer doing the talking. You have control over the habit as opposed to it having control over you. 2 to 4 weeks after stopping, the anger, anxiety, difficulty concentrating, impatience, insomnia, restlessness, and depression have ended. In other words, the physical addiction is over. Now, 1 to 9 months after smoking, cilia, which is the fine hairs in your lungs, have regrown. They get burnt off with your smoking. It's a constant chemical assault on your lungs. So as those cilia have regrown, your ability to clear mucus and keep your lungs clean and reduce infections has improved dramatically. And again, after 2 to 4 weeks, your anger and anxiety have ended. Your heart attack risk has started to drop, and your lung function is improving. So 21 days after stopping smoking, the acetylcholine receptors in your brain, which have been upregulated as a result of you consuming nicotine regularly, they've now substantially downregulated, almost back to the level of a non-smoker. Like we said, the physical addiction and now the psychological addiction is pretty much backed off after 3 weeks. Now, 3 weeks to 3 months after stopping, your circulation has substantially improved, and your chronic cough should be gone. If it's not, get it checked by a doctor. Why? Because chronic cough can be a sign of lung cancer, so get it checked out. Don't shortchange yourself. Now, 4 weeks after quitting, plasma SUPAR, it's an inflammatory biomarker, and it's predictive of development of diseases from diabetes to cancer in smokers, so you didn't know that smoking contributed to diabetes. But anyway, within 4 weeks of quitting smoking, your SUPAR levels had fallen to levels no longer significantly different from the never smokers' values. In other words, those levels have normalized, so you're drastically reducing your risk of contracting cancer and diabetes, in that it's directly related to smoking. Now, 8 weeks after you stop, insulin resistance has normalized, which is very important, again, for diabetes. Now, after a year, your excess risk, in other words, this is your risk over and above if you weren't smoking, of coronary heart disease, heart attack, and stroke has dropped to less than half that of a smoker. So you're still higher risk, but it's dropped by about half. 5 years out, your risk of subarachnoid hemorrhage, which is a form of stroke, has declined by virtually 60%. And if you're a female ex-smoker, your risk of developing diabetes is now the same as that of a non-smoker, all other things considered equal. 5 to 15 years after quitting smoking, your risk of stroke has declined to that of a non-smoker. So, hey, you're back to square one. Brilliant. 10 years after smoking, your risk of being diagnosed with lung cancer is 50 to 70% lower, and your risk of developing diabetes for both men and women is now similar to that of a never smoker. And the reason there's a crossover in some of these numbers is because different studies had slightly different findings. 13 years after stopping smoking, your risk of smoking-induced tooth loss has declined to that of a never smoker. Now, 15 years after stopping smoking, your risk of coronary heart disease is the same as someone who has never smoked. Same goes for pancreatic cancer. 20 years of stopping smoking, your risk of death from all smoking-related causes has now reduced to that of a non-smoker. And pancreatic cancer has declined to that of a never smoker. So like we said, there's some overlap in the statistics and numbers because they're from different studies. Here's the key question. How can you stop smoking easily, safely, and effectively? Now, the old way, you can stop cold turkey, and we found from our video in part 1 that you've got about a 4% chance of stopping smoking for a year or longer. So in the old way, you stop smoking, then you wait for the desire to fade away, which takes 3 weeks at least. Quitting is difficult. The easy way, well, let's reverse the tables and actually take away your reasons for smoking in the first place. Then, because you have no reason to pick the cigarettes back up, it becomes a lot simpler to stop smoking. Quitting becomes a lot easier. So like I said yesterday, I don't make any money out of recommending this program. I'm just sharing the love with you so that you can improve your life or that of your loved ones and overcome a habit that is controlling and in many ways destroying your life. So Alan Carr discovered this method, and he was a 60 to 100 cigarette a day smoker for more than 30 years. Now, this program has an 80% plus success rate after 3 months and a 50% plus success rate after 1 year. And the research studies that demonstrate that, they're peer-reviewed independent research, they're on the website. So how can you give up, quit, stop smoking the easy way? There's several ways. You can either read the book, or you can go to the website and do an online course, or you can go to a live one-day seminar that runs for approximately 5 hours. The results are, in the very least, 3 times better than the best that the mainstream can currently offer you. So where do you go to find that information? You go to www.alancarr.com.
Okay, so for more videos like that one, go over here, click on the red heart apple and subscribe to our YouTube channel, ring the bell so you're kept up to date with new videos, and while you're at it, go down into the description box below and give our Facebook page a like, and we'll talk to you again soon.